Miscellaneous antifungal agent. The antifungal agents are also called as antimycotic agents. Its function is to kill or inactivate fungi and are used to treat fungal infections, including the yeast infections. Pathogenic fungi affecting animals are eukaryotes, generally are existing as either filamentous molds or intracellular yeast. Clinically relevant dimorphic fungi grow as yeast-like forms in a host, but as molds in vitro at room temperature. It includes the Candida species such as Blastomyces dermatitidis, Coccidioides immitis, and Histoplasma capsulation. Agents like phenols, iodine, and mercurial has an antibacterial as well as antifungal activity, but this may cause damage to normal tissue. Several factors can lead to therapeutic failure or relapse after antifungal therapy. A longer duration of therapy contributes to another common cause of therapeutic failure such as host toxicity. Fungi are also known as mycosis. It was considered as a very large and diverse group of microorganisms. It has two major types, the yeast and molds. The mycotic infection can either be cutaneous, subcutaneous, superficial, and systemic. Fungal infection or mycosis can either be both superficial and systemic. The systemic infection includes candidiasis, cryptococcal meningitis, aspergillosis, and blastomycosis. The dermatophytosis belongs to the superficial and irritating. It is caused by many fungi and it can invade in various aspects of body. It can also invade in various aspects of the body, including the infection to keratinized epithelium, hair follicles, and nail apparatus. Blastomycosis is a systematic and life-threatening. It is a systematic fungal infection that occurs in various animals. It can be fatal if not diagnosed early. These are drugs for antifungals or miscellaneous. The iodides, phenols, and mercurial are some. These drugs have antibacterial as well as antifungal activity, but they may cause damage to normal tissues. The examples of iodides are amphotericin B, sodium and potassium iodide. Sodium and potassium iodide have both been used to treat selected bacterial anticomycet and fungal infection, although sodium iodide is preferred. Sodium iodide has been used successfully to treat cutaneous and cutaneous lymphadenitis forms of sporotrichosis. It attempts to control various other mycotic infections with iodides. Potassium iodide has been successfully used for treatment of erythema multiforme. The potassium iodide has been reported for a good response to widespread cases of disease. In the late 70s, iodinated contrast agents were considered to be a major cause of acute iatrogenic renal failure. That is why over the last decades, new contrast agents have been synthesized, non-ionic and less hyperosmolar. Amphotericin B are potentially nephrotic antibiotics in current use. Phenols. The examples are chlorhexidine digluconate and camphorphenol. Phenol is an antiseptic and disinfectant used in a variety of settings. It is known as the oldest antiseptic agent. Phenol can be in a form of injectable solution, mouthwash, oral solution, topical cream, or topical spray. Phenol produces a chemical neurolysis which is non-selective across nerve fiber size and most prominent on its outer aspect. Phenol is rapidly absorbed through the skin and into the lungs. Its main target are thermolysin and serum albumin. Its mode of action is that phenol produces a chemical neurolysis which is non-selective across nerve fiber size and most prominent on its outer aspect. It is initially used as antifungal and disinfectant. The drug of choice is chloraseptic to treat pharyngitis. The adverse effect is that oral ingestion or extensive application to skin can cause systematic toxicity. Mercurials. Examples are merbafen and meraluride. Its mode of action is that these drugs primarily inhibit NAK2Cl cotransporter. It plays an important role in renal salt reabsorption and in salt secretion by intestinal, airway, salivary gland, and other secretory epithelia in the ascending limb of Henle's loop and produce acidic urine. It involves in the interaction with sulfhydryl enzymes in kidney tubules. It is used for the treatment of congestive heart failure due to edema, chronic nephritis, signs of liver disease, and nephrotic edema. The drug of choice is that mercury chloride or the calomel were found to have diuretic properties when they were used to treat syphilis. Adverse effect is that nephrotic syndrome. The nephrotic syndrome is a collection of symptoms due to kidney damage. These are the other drugs that are involved in the miscellaneous antifungals. First is the monosulfuram. It is an insecticide and included in some preparation when fungicidal and miticidal activity is required. Next is the dichlorofen. The mode of action are effective against trichophyton and microsporum. It is used as tenicide and fungicide. It is available as 2% ointment or alcoholic solution. Other drugs includes dyes, such as carbolfuchsin. Its mode of action is that it is used in staining of mycobacteria because it has an affinity for the mycolic acids found in their cell membranes. The uses are the topical antiseptic and the antifungal. The other drugs that are related to dyes is the gentian violet. Its mode of action is that dissociates into positive and negative gentian violet that penetrate through the wall and membrane of both gram-positive and gram-negative bacterial cells. Gentian violet is an antiseptic violet dye, used to prevent various infections, including fungal and bacterial infections. It is an antiseptic for external use and antihelminthic agent by oral administration. There is no serious side effects have been reported when used externally. However, oral administration can cause gastrointestinal irritation, and intravenous injection can cause depression in the white blood cell count.